Snowbirds will soon be thinking about heading south, and maybe even you're planning a sunny getaway this fall or winter.
When you leave Canada, you should always have travel medical insurance, and be sure you understand the plan that you've signed up for. Pat Ford explains on Consumer Alert. Pat.
Thanks, Michelle and Raheem. It's important to have travel insurance once you leave the country to cover any hospital bills or in case you need a medical flight home. But if you have any pre-existing health problems, your coverage could be canceled when you need it most. Cynthia Tyrell lived in Muskoka with her husband, Steve McMillan. She had a career as a social worker helping families and was featured on CTV News in Barrie.
There's a growing need for children's mental health services in Muskoka and across the province, in fact.
Tyrell was diagnosed with cancer in 2019. She underwent various treatments, but in March of 2022, she felt well enough to go to Florida for a vacation.
The doctor said, once after this radiation treatment, if you're feeling okay, away you go. And she wanted to get into the sun and enjoy herself, so we went.
But when Tyrell got to Florida, her condition grew worse. She was hospitalized and eventually needed a medical flight back to Canada.
She spent 10 days in the hospital, and they airlifted her back to Simcoe.
Tyrell passed away not long after returning home. The couple had travel insurance, but because Tyrell was being treated for cancer, her claim was denied. McMillan got a bill saying he owes almost $125,000 US for the flight and hospital bill.
It's quite a bit of money, so I'm just not sure what to do.
The policy was through Green Shield, and a spokesperson said, "We can confirm all claim decisions involve multiple levels of review with both internal claims examiners and external medical experts."
You have to know what the stability clause is of your contract.
Martin Firestone, a travel insurance expert, says most policies have a stability clause, and if you're being treated for any health issue, even a change in medication can be enough to void your claim.
If you've had any of those things, doctor visits, hospital visits, complaints of any sort, they basically rule you out for any chance of a claim being paid.
McMillan says he doesn't know how he'll pay the huge bill.
They're not aggressively chasing me yet, but I'm sure it's going to ramp up.
And Firestone says anyone with a huge out-of-country medical bill can try to negotiate a lower amount. And he says if you're unwell or have health problems, you may want to consider staying home. On your side, I'm Pat Foran.
If you have a consumer story idea, email us at alert@ctv.ca.